New South Wales has recorded no new local cases of COVID-19 after more than 13,000 people came forward to get tested. But there were 5 new cases in hotel quarantine, and health authorities still aren't sure how the virus got out. Restrictions, including wearing face masks indoors, have rolled out across Greater Sydney.
Dr. Norman Swan is co-host of the CoronaCast podcast and Radio National's Health Report, and he joins us now. Promising news today, no doubt about that, but surely Sydney is still far from in the clear.
It is far from in the clear. I mean, it depends on the testing rate. So thousands of people have got to get tested to make sure there's no virus circulating in the community. People have got to come forward in those contact places. This couple travelled around a lot, and not their fault. They were pretty good at their QR codes. But, if we go back to the beginning of this pandemic, if you might remember, in Washington State, this went underground for 6 weeks. You can get chains of transmission in young people where it's asymptomatic and it just pops up a few weeks later. So you've really got to nail this very, very quickly, and more cases could emerge.
Norman, the government will resume repatriation flights from India at the end of next week. But will this 2-week pause actually mean that more of those returning Aussies will arrive here infected?
100%. The numbers of people, this comes from Professor Tony Blakely at the University of Melbourne, who's done the calculation. There's 100 people per 100,000 being infected every day. That's almost 1% of the population. Now, it's not evenly spread. People living in disadvantaged communities in the shanty towns and elsewhere are going to be more at risk than other people. So if you're middle-class Indian living relatively isolated, your risk is much lower. But that's enormous, 1% per day. I mean, it can't go on like that. But you're absolutely right. The risk accumulates with each day you stay in India.
Dr. Swan, it certainly makes vaccination so important, and we've seen some more local cases of blood clotting linked to the AstraZeneca vaccine this week. Are those numbers still tracking as expected?
They are. So it's round about 1 in 100,000 to 1 in 200,000 doses in the over 50s. And we're only going to see it in the over 50s from now on, because that's the group that's being immunised with AstraZeneca. And that's the figure that seems to be landing in Europe and landing in the UK and Canada and here. So that's the expected incidence. The good news is that I think the doctors are getting better at recognising it earlier, how to treat it and how not to treat it, because you can do things that are bad for this condition. And the mortality rate in Australia is very low. It's not the 20 to 40% that we've seen overseas.
Well, Norman Swan, Dr. Norman Swan, you're a Sydney-sider, but you managed to get the jab while you were down in Victoria. How was it? Did you look? Yeah,
this was a pact I did with Michael Rowland from News Breakfast, that we'd have it together, and I was down in Melbourne. Yep, it was great. And it shows the value of these high-throughput centres, which have yet to get going in New South Wales and some other states. It was just a very smooth process. You get registered, you go in, and some pharmacist has got all the stuff ready to go. You get your jab, you wait, and you go out. The slowest thing was actually being filmed.
Dr. Norman Swan, we appreciate your time. Thanks for your company.
Always welcome.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.